Hello everyone, myself Dr. Spandana Kanaparthi, consultant physician at Renova Hospital. Today I'll be talking about diabetes. So coming to the diabetes is a metabolic disorder characterized by increased blood sugars because of insulin deficiency or insulin resistance. It is usually classified as type 1 and type 2 diabetes. So in type 1 diabetes, there is absolute or insulin deficiency, relative insulin deficiency, which is because of autoimmune destruction of beta cells resulting in low production of insulin. As a result, there will be increase in blood sugar levels because the body cannot utilize blood glucose in the absence of insulin. And coming to type 2 diabetes, there will be peripheral resistance to insulin. That is, the blood cells cannot utilize blood glucose because of insulin resistance. So this will result in high blood sugars. And there is one more type, gestational diabetes, that is diabetes in pregnancy. And I'll be discussing about these three types for the next few minutes. Coming to type 1 diabetics, it is because of autoimmune problem. That is, there will be antibodies against these beta cells which produce insulin. Insulin is a hormone responsible for the body to utilize glucose. It mediates the body cells to utilize the glucose. So because of autoimmune destruction of beta cells, there will be low production of insulin. As a result, there will be high blood sugars. And coming to type 2, and in type 1 diabetes, usually it is seen, it occurs at any age, usually seen in young individuals. And the patients will have usually lean body habitus. And coming to type 2 diabetes, the body cells are resistant to insulin, so they cannot utilize the blood glucose levels even there is enough amount of insulin due to many other factors. Patients will be usually obese. So because of insulin resistance, there will be high blood glucose levels. And coming to the gestational diabetes, this is usually seen after 20 weeks of pregnancy. So patients will usually present with high blood sugars, which is usually seen through routine blood testing, glucose testing. And so the pregnant patients needs to be put on medication for this, for effective control of sugars. If not, there will be miscarriages or preterm labors. And if pregnancy is, if already a patient who is already pregnant becomes already diabetic becomes pregnant, patients might develop developmental anomalies of the fetus because of high blood sugars, for which every pregnant woman should be screened at the time of pregnancy, detection of pregnancy, to see that the blood glucose levels are under control to prevent congenital anomalies in the baby. Thank you.